Hi, I'm Dr. Daniela Stein. I'm a medical doctor and I'm a wellness expert. Thank you so much for watching my YouTube video. Please like and subscribe, and you can join my email list if you want wellness advice right into your inbox. I'm a medical doctor, but I have this passion for lifestyle medicine, holistic medicine, functional medicine. And a lot of people come to see me specifically regarding menopause. And then what I'm going to talk about today is urinary tract infections during and after menopause. It is very common for women to get urinary tract infections, way more than men, because women has a shorter urethra, whereas phenotypically males have a longer urethra, so bacteria can easier from the outside crawl up and get into the bladder. It is not always a problem if there is bacteria in the urine. It happens all the time that we do get bacteria in the urine, and then when we urinate, we flush those bacteria out again. So typically, if you drink lots of water during the day and you urinate frequently, you're less likely to get a bladder infection than someone who is dehydrated, not drinking much. So usually first line, we will say to drink more fluids. Next one would be to look at the whole person. When you're immunocompromised, when you're a diabetic, you could have urinary tract infections more often. The reason we see it more after menopause is after menopause, your estrogen levels drop. And estrogen keeps your vaginal skin very thick and plump. And then as the vaginal skin thins out, there's two things that happen. The one is your pH change, the bacteria on the skin, your microbiome change, the bacteria in your gut, and then also the skin itself gets thinner. So the way we would manage it after menopause is, first of all, always to look at lifestyle. I'm passionate about lifestyle. I always first advise to do things to heal your gut, to change the bacteria in your body. So to make sure that you eat in such a way to have healthy bacteria in your gut and then on your skin. So typically when I test for urinary tract infections, one of the most common infections would be E. coli, which is a bacteria which you have in your gut, and you will typically have that when you have a stool, a bowel movement, there will be E. coli in it. And then around your vaginal area, there's lactobacilli that usually protects you from those bacteria going in. So a way to counter your E. coli would be to have more lactobacilli. That's a probiotic that you can apply directly onto your skin, and you can take lots of it by mouth. When people tell me that they're having these severe infections, you can have applied vaginally directly to work quicker, your lactobacilli. So that is something to make sure your vaginal E. coli is ecology. So the E. coli is the bacteria, but then your good bacteria that you want in the vaginal area, you want to make sure that you don't use perfume soaps, that you wash with clean water look at the underwear that you're wearing. You don't want to wear bleached pads because that can worsen it, because white pads get bleached. You don't want bleach in the vaginal area. You want to stay well hydrated. That's what we look at first. Then secondly, when people come and ask me, what do I think about cranberry? I must stress back a little bit. It is important to go and see your doctor. I really want to help you. I want to take your hand, enable you to live with optimal life, take ownership of your own health. But it is important to see your doctor if you think you could have a bladder infection. If we have bacteria in the urine and we urinate it out, we might be okay. For some people, when that bacteria stays there, it can continue to grow and it can make you sick. And I admit people to hospital with urosepsis, a bacterial urinary tract infection that wasn't treated, spread up to the kidneys, can do damage, can cause sepsis throughout the whole body. I admit people to ICU with urosepsis. It can make you very sick. So you have to get help. You have to see your doctor. There are things, though, that you can do if you do get bladder infections very frequently. You might consider an estrogen cream to thicken the skin. I even give it to my patients in their 90s, even if you don't want hormone replacement therapy for for menopause, if you don't have any other menopausal symptoms, you don't have to use your hormone replacement therapy, but you can use a localized estrogen cream. You might need to use it daily initially to just get the vaginal skin a bit thicker. You can then go to 3 times a week, then weekly. With much older people, we often insert it as a vaginal pessary. I don't want any of you to give me hate mail and say, oh, I push for lifestyle, I push for healthy living, and now I'm pushing for estrogen. I'm not pushing for estrogen. I want to tell you that if you get to a point where it's affecting your quality of life, that you have to frequently have urinary tract if you frequently have urinary tract infections and have to go on antibiotics, one of the ways that your doctor might consider, just have an open mind for that, estrogen might be the way to go. Cranberry works very well in a lot of people. When you do have a bladder infection, you can drink loads of cranberry juice. To be preventative, you can take a supplement, cranberry 500 milligrams twice daily. If you have an infection at that time, you'll double up your dose. And then probiotics are very helpful. Let me know if you have any questions. See your primary care provider. Please like this video, subscribe to my YouTube, sign up for my newsletter. All the best.